Fatigue, it is the silent symptom of MS that has the single biggest impact on people with MS day to day. When you hear the, "Oh, but you look so good," people don't understand what you're going through, and they definitely don't understand the impact of fatigue on the lives of people with MS. We know up to 80% of people, 90% of people have fatigue from MS. 80% it's activity living, at least at some time. 60% it's activity living daily. And the impact is disabling, even more so than mild physical symptoms. Fatigue can push people out of the workforce, affects families, affects interactions, affects your life, your quality of life. Now, we'll get into this a bit more, but there's fatigue due to MS, and there's the fatigue due to other things, and they play off each other. So to try to understand fatigue, we need to think about kind of the different types of fatigue. So we have the fatigue associated with MS. It's primary fatigue. It's caused by MS. We don't exactly understand where this fatigue comes from. We know in part the primary fatigue of MS is related to maybe certain areas of the brain that are affected. The frontal lobes, the reticular activating system is an area in the brain that's responsible for alertness and attention. So a lot of these physical structures in the brain have been implicated, yet we'll see people with profound fatigue who have no lesions in any of those areas. So it's more than just that. We don't fully understand what primary MS fatigue really is or where it comes from. Now, we do understand more about motor fatigue. Motor fatigue would be the physical exhaustion that you have when your legs just weaken. If you're exercise a little or even walking to the mailbox or transferring, going from your bed to the bathroom, you may fatigue, and that's a physical fatigue that seems to be coming almost directly from spinal cord involvement. So spinal cord is a really big piece of the physical mobility fatigue that we see in persons with MS. Now, secondary fatigue isn't related to MS, at least not directly related to MS. So secondary fatigue can come from lots of things. I'll show you a few other examples on the next slide. And then we have this on this side, tiredness. Well, tiredness and sleepiness. There are things besides there are neurological conditions, narcolepsy, various other disorders where someone suddenly becomes profoundly fatigued, even just like falls asleep. That would be more narcolepsy. Multiple sleep latency tests can define that. So sleepiness is different than fatigue. And sleepiness may have organic causes in your lifestyle. If you're not sleeping well, maybe you have restless leg syndrome or some of these other secondary neurological symptoms. So here's some of the primary and secondary causes. If we're thinking about primary fatigue, and again, what I'd point out is all of these causes of fatigue overlap and magnify each other. So if you have primary MS fatigue and you have tiredness because your circadian rhythm is all messed up, you're not sleeping well, or maybe you have sleep apnea, or maybe you have restless leg syndrome, your legs are moving around in your sleep. You may not be aware of that, but it's disrupting your natural sleep patterns. So when you wake up in the morning, you've been in bed with your eyes closed for 8 hours, you wake up in the morning, you're not rested. So lots of things go on in sleep, and so we need to be aware of that. So teasing these things out are the first step to treating the underlying problem of fatigue to make it better. So if you are depressed, there might be medications. Maybe you're anemic. These are things that aren't directly related to your MS, or maybe it's a medication that is related to your MS. Gabapentin we might be giving you for tingling and numbness that could actually be increasing your fatigue. So we have to look globally at all these things. Nutritional, if you're not taking in enough calories or not the right types of calories. If you have respiratory issues, shortness of breath, COPD, thyroid problems. By the way, thyroid problems are one of the most common overlap autoimmune diseases we see in MS. Up to 30% of people with MS are going to develop thyroid problems. We can measure the blood in antibodies in the blood of people with MS and see antibodies against their thyroid gland. More than 30% of people have those antibodies in their blood if they have MS. So very common problem. Fatigue is the #1 symptom of hypothyroidism. So we can't just focus on the MS part. We have to tease all of these out and understand what they are. And each of them can be treatable in and of themselves. Now, in order to tease this out, we have to measure it. And in part, this is important for studying treatments in clinical trials to say we want objective measurement systems. So some of these scales, visual analog scale, modified fatigue impact scale, just a fatigue severity scale, all of these are things that can be done mostly in clinical trials or in some cases in the setting of an MS center. In a general neurology practice, you're not going to see a neurologist be really able to do some of these things. A modified fatigue impact scale is a really important one because it will actually help us split out those physical fatigue issues versus a cognitive versus psychosocial. So that's a questionnaire type form that will help identify if there's something more going on maybe in your social life or your sleep hygiene and how you're getting to sleep. But part of some of the self-help things I'm going to talk about, you have to learn to listen to your body and what your body is telling you on that day. Jump to the medications. Well, medications for fatigue management aren't all that effective. In that meta-analysis, the medications didn't really do so well. Amantadine, modafinil, armodafinil, amphetamines aren't necessarily FDA approved, but we use them a lot for MS-related fatigue. But while those were the most effective of some of the medication treatments, the single most effective thing is physical exercise, cardio, or otherwise daily activity levels. Really, really important for managing one's fatigue. Now, this is really about thinking about the whole person rather than just let's throw a medicine at this or a medicine at that. So, and as we go through this, think more and more. What are the non-pharmacological treatments we can use? I already mentioned exercise right at the top. Aerobic exercise primarily, but resistance training, interval training, intervals are like you go really hard for an exercise at 30 seconds and then you rest for 10 or 20 seconds or go hard a minute and rest and do that over and over again. Some of these other approaches you might combine as well, but when it comes right down to it, you have to learn how to manage these things yourself. So energy management. Plan in your day. Try to schedule activities, more strenuous activities where you have the most energy. It varies for everyone, but most people have more energy earlier in the day, or maybe you have energy after a nap, or as well as taking naps and planning breaks during your day. So staying cool, keeping yourself cool, even if that's just drinking ice water, if you're exercising, wearing a cooling vest. By the way, the MS Society can get you a cooling vest if you don't have one. And otherwise, you might find, again, that listen to your body and just really plan your day around your energy level that day. Be flexible. And today may not be a good day. Tomorrow could be a better day. That's kind of how MS fatigue goes. Now, if you are going to develop an exercise program, very, very important hack here would be to make sure that you're exercising appropriately for who you are, whether it's your MS, or whether it's deconditioning, maybe there are other medical problems. So it's really important to check in with either your doctor or a physical therapist when you're thinking about developing an exercise program for your fatigue or for anything else. By the way, besides fatigue, you know what exercise is really good for in MS? So somebody said depression, I heard it. 20 milligrams of Prozac a day is roughly the equivalent antidepressant effect or the equivalent to daily cardiovascular exercise, both for preventing and treating a depression. Cognitive improvement, if you have cognitive problems, what is the number one thing you can do to improve cognitive function? Cardiovascular exercise. Listen to your body. Now, we might try to give blanket statements about you should do cardiovascular exercise every day. Great. But not everybody can, not everybody should. So your exercise program should be tailored to you. And somebody who knows you well, your doctor, honestly, neurologists aren't really the best people to tell you how to exercise. I have a little more experience with that than probably most, but I'm not as good at it as a physical therapist is. Use those resources that you have, whether it's a physical therapist, an occupational therapist if you're talking about, and this is for exercise, but occupational therapists can be very valuable in helping you plan your life, organize your life, various tools to help you manage the fatigue that you have and live with the fatigue. Using appropriate assist devices. Scooters are great. Scooters should be used to conserve your energy so you can spend it when you get to where you're going, right? I see some people using scooters and they probably need a power chair. I see some people using gait aids the wrong way, or maybe they're using, you know, those quad cane, those 4-prong canes. Those are for people with strokes who need to lean on them. They're awkward for someone with MS to use if you have a balance problem. A quad cane, you catch the edge of those things, could actually trip you up and make you fall. So any device that you use, make sure it's appropriate for you. Your physical therapist or your occupational therapist will be able to tell you that. These are very important people to have in your lives if you're living with any disability from your MS. Exercise. You do want to make sure your exercise routine is appropriate for who you are, where you are in your physical condition. Maybe you have no problems at all from your MS or very, very mild. But if you're not physically conditioned, you need to have a gradual increase in your exercise program. If you have, again, especially if you have other medical problems. You're getting a lot of exercise in your daily activities, organizing those activities to maximize that exercise. Conserving your energy where you need to. Medications we talked about already, assessing that. Might even be necessary to have you see a dietitian or nutritionist to say, are you getting enough calories? Are you getting the right type of calories? And stimulants. Stimulants are great, right? But when you take a stimulant, caffeine robs energy from the future to give it to you right now. Alcohol, another one, totally disrupts your sleep cycles, your sleep-wake cycles. So really, many people with MS gradually just stop drinking for whether it's maybe it makes their balance worse. I think often the fatigue impact when it's disrupting your sleep. Brain fog, all of these are things you can do, but sleep. And of course, your mental health. Depression can come out and be mostly felt as fatigue. You may not have a depressed mood, you may just have physical symptoms. So very important to think about all of these things as part of a management plan for fatigue.